Jenny, do you give me permission to have you in my video?
Yes.
Hi, I'm Kayla. I'm going to be your nurse today. Can you please state your first and last name and date of birth?
Jennifer Weisner, July 10th, 1999.
Thank you. And I have already washed my hands, so today we're going to be doing a full assessment, head to toe assessment. I have provided privacy and I will put gloves on if necessary. Can you tell me where you're at right now?
My roommate's bedroom.
And what time is it about?
4:30.
And why you're here today?
Physical assessment.
And then your first name?
Jenny.
Okay, my patient is alert and oriented ×4. Do you have any previous or current medical conditions, histories that would affect anything today?
No.
Perfect. How are you feeling today?
Good.
Perfect. My patient is good. She's in a good behavior. She's sitting upright. Her clothes are appropriate. Her hair is clean, not dirty. And her speech is clear and articulate. All right, so her face is white with an olive undertone. She doesn't have any lesions on her face. Her eyes are symmetrical to the top of her ear on both sides. Her nose is midline. And then her hair, there's no lesions or signs of parasites. So now I'm going to begin. So I'm going to start with your eyes. So if you could please pull down like this for me. And I'm just looking at your sclera. There is limited redness, which is good, veins, which is good, and then her conjunctiva is clear. So now I'm going to do the positions assessment. So I just want you to follow my pen. I'm going to move it in a few directions. Don't move your head, just move your eyes. Good. Now I want you to look over my shoulder and I'm just going to look at your pupils. So I would say this one is 4 millimeters. This one is 4 millimeters, which is good. So they're round and equal. And now I'm going to shine direct light and indirect light. So I'm just going to shine it into your eye to see if your pupil constricts. Good. Okay, so now I'm going to do indirect light. So I'll be shining it in your right eye, or in your left eye, and looking at your right eye. Good. So they both constricted with direct and indirect light. So now I'm going to want you to follow the tip of my pen. I'm just going to bring it up to your nose. Her eyes accommodated, so they're equal, round, reactive to light, and accommodation. So now I'm going to assess your mouth. So her lips are pink and moist. Do you have dentures?
Nope.
Do you have tonsils?
Yes.
Okay. So her teeth are white. Does not look like she has any dental caries. Her soft palate is pink, no lesions. Her buccal mucosas are pink, no lesions. Under her tongue and top of her tongue are both pink, no lesions. Does look like she has a retainer. And then I would ask if I had a tongue suppressor, I would just push that on your tongue, but I'm just going to ask you to say ah and stick out your tongue.
Ah.
So I'm assessing her tonsils.
Ah.
And I would say they are a +1, so her tonsils are not touching, they're not swollen, they have no discharge on them, it's just pink and moist throughout. So now I'm going to assess your throat. She has no lesions on her throat, and then is it okay if I touch your neck? Okay, so I'm just going to make sure her trachea is symmetrical, and then I'm just going to palpate for any abnormalities like masses. Okay, no masses. She is sitting up straight. She is breathing room air oxygen, and accessory muscles would be her trapezius or her intercostal muscles. So now I'm going to do your posterior thorax. If you stand up, Thank you. And I'm just going to assess your spine. Her spine is symmetrical, midline, no curvatures. And then I'm going to place my hands here and I want you to take a deep breath in and out. So her chest elevation is good. That is normal. My thumb's moved about 2 inches, which is normal. So now I'm going to listen to her posterior lungs, and I'm just going to put this here, and if you could take a deep breath in through your mouth, or in through your nose and out through your mouth every time I move this. Good. Good. A few more times. Over here. Good. And then over here. Her lung sounds are clear. There's no cracks or bubbles. And then I'm going to listen to your anterior thorax. So same thing, breathe in through your nose, out through your mouth. Good. Good. So again, her lungs are clear, no bubbles or bronchi or cracks. So now I'm going to assess your abdomen. If you could just lie down for me and just pull pants down a little. Thank you. And if she had a gown, I would just pull her gown up. So I'm just going to be looking at your stomach. So I don't see any discoloration. I do see these 2 marks. Are they birthmarks?
Yeah, they're birthmarks.
Perfect. The quadrants are symmetrical. There's no distension, and her stomach is flat. So I'm going to, or her belly button is also, there's no redness, no discharge, anything like that. So do you have any pain in your stomach today?
No.
Okay, perfect. And I'm just going to listen. I'm going to start in the right lower quadrant. Her bowel sounds, her stomach is active with 10 to 12 sounds, which is normal. And you said no pain, so I'm just going to palpate, starting in the right lower quadrant. If you did have pain, I would end in the quadrant that you have pain, going clockwise. Any pain?
No.
Here?
No.
Here?
No.
Here?
No.
Here?
No. No.
And here. Okay, so she has no pain. Her abdomen is soft. She was not grimacing, so she was not in any pain. And then if you could just sit up, I'm going to do a kidney test. So I'm just going to place, sorry, my hands are cold. I'm just going to place my hand here and let me know if you have any pain.
Nope.
Nope. Perfect. So now I'm going to place my patient in a comfortable position. I will lower the bed to the lowest position. I will make sure the call light is in reach, items are in reach, and I would put the safety rails up ×2, and then check for a safe environment, and then I would document my findings.